What is peripheral arterial disease?
Peripheral arterial or peripheral vascular disease is disease of the blood vessels that supply blood flow to the feet and lower extremities. It's a form of arteriosclerosis or hardening of the arteries, where the arteries will actually develop plaque buildup in the walls of the arteries themselves that narrow the arteries and decrease the amount of flow that goes to the feet and the calves and the thighs, which can cause pain when you exert yourself. Over time, if the blockages get severe enough, it can cause pain at rest.
What are the symptoms of peripheral arterial disease?
The symptoms of PAD are related to the blockage in the artery themselves, and most commonly you see pain when you're exerting yourself. It starts out with exertion that's fairly severe, walking up steps, walking long distances, but as the blockages get worse, you can develop pain with less and less exercise. That's the most common presentation, called claudication. But about 50% of folks don't get pain at all. They have atypical symptoms. They can have pain, tiredness, achiness, burning in the thighs, the calves, or the feet. So you see a wide variety of symptoms. Some people, as the disease progresses, will develop pain in the lower extremities, where if you put your feet up in bed, the only way you can get the pain to get better is dangling your feet off the side of the bed. So if you start to develop any symptoms that are unusual in your lower extremities, it's a good thing to talk to your doctor.
What are the risk factors for PAD?
The risk factors for PAD are very similar to the risk factors for coronary artery disease when you develop blockages in the arteries of your heart, or with cerebrovascular disease when you develop a stroke or TIA. Because the arterial system is one throughout the body, if you develop blockages anywhere in your heart, or if you've had a stroke, you can also develop blockages in your legs. The risk factors we most commonly associate are age, hypertension, diabetes, high cholesterol, smoking history. Even folks that have end-stage renal disease who require dialysis are at high risk for PAD. And obviously, if you've had blockages in your heart arteries or in your, if you've ever had a stroke, those put you at high risk for blockages in your legs as well.
How is PAD treated?
PAD is treated most commonly with exercise. What we do is doctors can walk you through a graded exercise program where you exert yourself to the point of pain, and then you stop and you exert yourself again. And by doing that, you can develop small vessels called collaterals, which will allow flow around the blockages and increase your ability to walk. If you have diabetes, you want to control your sugars. If you have diabetes, you also want to make sure you don't develop any sores on your feet or ankles, because these can develop into sores that won't heal if the blood flow gets severe enough. You want to control your blood pressure. You want to control really any risk factors. If you're overweight, you want to make sure that you eat you improve your lifestyle and eat a more healthy diet. If that does not work, then the next step is medicines. We often use aspirin and Plavix to prevent the risk or reduce the risk of clots forming in the legs. We can use cilostazol, which is a medicine which dilates the arteries and can decrease the amount of pain folks have that have blockages in their legs. And finally, if those do not work, you can consider percutaneous intervention or surgery, where we can actually go in with stents and balloons and open up the arteries of the legs, similar to what we do when you have a blockage in your heart artery. We can do atherectomy, where we shave off plaque within the arterial wall, and finally bypass surgery is an option. So it's real important just to talk with your doctor and see what your options are.